Hello everybody, my name is Khaled Hassan Ibrahim, MBBS, Milan University, Master of Clinical Human Anatomy, National University. Today we are going to talk about the lower limb. First of all, we will start by osteology of the lower limb. We can divide the lower limb into many regions. We have this area, the buttock or gluteal region. We have the hip region. We have the thigh, which contain the femur, the longest bone in the body. We have also the knee region. We have the leg from the knee to the ankle, and we have the ankle region, and distally we have the foot. First of all, we will talk about the osteology. Then we will talk about the joints of the lower limb. Then we will go to talk about the compartment of the thigh, compartment of the leg, and structure located in the foot. And also we will talk about the muscles of the gluteal region. This is the pelvic bones or two hip bones. The two hip bones is the right one, this is the left one. The two hip bones or inguinal bones articulate anteriorly and join to each other to form symphysis pubis, which is the secondary cartilaginous joint. The right hip and left hip bones articulate posteriorly with the sacrum to form right and left sacroiliac joints. So this is the right hip bone, this is the left hip bone, this is the symphysis pubis, this is the right and left sacroiliac joints posteriorly. In the hip bone, this is the inner aspect. This area is called the ala of the hip bone. The superior part of the hip bone is formed by the ilium. The anterior inferior part is formed by pubis. The inferior posterior part is formed by ischium. So we have three bones from the hip bone: ischium inferiorly, pubic anterior inferiorly, and the ilium superiorly. Also, this is a hip bone. This is the inner aspect of the hip bone. This is the ilium. This is the pubic, and this is the ischium. There are many parts or important landmarks or structure in the ilium. This area is called anterior superior iliac spine. This prominent part is called anterior inferior iliac spine. We have many structures attached to this area, anterior superior iliac spine. For example, inguinal ligaments, muscle like sartorius muscle. This is called the iliac crest, the iliac crest. Posteriorly, this is a site of articulation with the sacrum, and here we have two prominent areas. This is posterior superior iliac spine, this is posterior inferior iliac spine. This line is called arcuate lines from boundaries of the pelvic rim. This area, this is a pubis. Pubis has many parts. This is called superior pubic ramus, and this is inferior pubic ramus. Here we have this prominent area, it's called pubic tubercle. So pubic tubercle, also site of attachment for inguinal ligaments. So the inguinal ligaments is attached to anterior superior iliac spine superiorly and to the pubic tubercle inferiorly. This foramen is called the obturator foramen. Usually it's covered by obturator membrane. We have one muscle located outer to this area, which is obturator externus and obturator internus internally. In this area, this is the ischium. This area in the ischium is called the ischial tuberosity. The ischial tuberosity, the area where we sit on. Also, it's a site of origin of the hamstring muscles, which are located in the posterior compartment of the thigh. Also, we have this area, which is called the ischial spine. Is a prominent part from the ischium. The ischial spine divides the posterior part into lesser and greater sciatic notch. Those notches are converted to foramen, lesser sciatic foramen in this part and greater sciatic foramen in this part by ligaments, sacrospinous ligament and sacrotuberous ligaments. In this area, in the ilium, this is called the gluteal surface. We have many lines, posterior lines, anterior line and inferior lines in the gluteal region. Again, in hip bone, this is the ilium, this is the pubis or pubic bone, this is the ischium. This is a pubic tubercle, this is superior pubic ramus, this is inferior pubic ramus, this is the obturator foramen, this is ischial tuberosity, this is the ischial spine. Also the ischial spine has very important relationship with the pudendal nerve. It can be used in the pudendal nerve anesthesia. This is the ilium, this is the ala of the ilium, this is the gluteal surface, this is the iliac crest, this is the inner side or called iliac fossa. It is the site of origin for iliacus muscles, Finally, we have this area in the hip bone which called the acetabulum. The acetabulum is the site of fusion between three bones, ilium, pubic and ischium. The acetabulum is a site for articulation with the femur, head of the femur to form the hip joint. This area is called acetabular notch. This is called the acetabular notch, which usually filled by ligaments called transverse acetabular ligament. Okay, let's go to talk about the femur. This is the femur, the longest bone in the body, the longest, heaviest, and the strongest bone in the body. The femur is found in the thigh regions. It has proximal part, shaft or body, and distal part. In the proximal part, this area in the femur is called the head of the femur. From the head to two trochanters, this is the lesser trochanter and this is the greater trochanter. We have neck of femur. Here anteriorly we have intertrochanteric line and posteriorly intertrochanteric crest. This area is the shaft of the femur. The shaft of the femur. The femur have anterior bowing. This is the distal part of the femur. The distal part of the femur. Here, this is the medial aspect and this is the lateral aspect. This is called the medial condyle and this is called the lateral condyle. This area is called the medial epicondyle and this area is called the lateral epicondyle. This is the medial epicondyle and this is the lateral epicondyle. Here, in the medial epicondyle, we have a tubercle which is called the abductor tubercle. Abductor tubercle is the site of insertion of abductor magnus. This is the patella. The patella is the largest sesamoid bone in the body. Regarding the greater trochanter and lesser trochanter, there are many muscles attached to lesser and greater trochanter respectively. What are the muscles inserted in the lesser trochanter? Iliopsoas muscles, iliacus and psoas major, unite with the same tendon and inserted in the lesser trochanter, and the action of the iliopsoas muscles is to flex the hip joint. This is the neck of femur again, and this is the greater trochanter. Also, there are many muscles attached to the greater trochanter, either anterior, superiorly, or posteriorly. For example, hip abductors and short rotators of the hip joint. This area is called the trochanteric fossa. Again, this is the head of the femur. In the head of the femur, we have the area for attachment of ligamentum teres or the ligament of the head of the femur. This is the neck of femur. This is the intertrochanteric crest posteriorly. This is the intertrochanteric line anteriorly. This is greater trochanter or GT. This is the lesser trochanter. This is the shaft of the femur. This is the distal part of the femur. This is the medial epicondyle. This is the medial condyle. This is the lateral epicondyle and lateral condyle. This is a patella. Posteriorly here we have fossa called the popliteal fossa. This is called intercondylar notch. And this is called the popliteal fossa. And here posteriorly we have line called linea aspera. Linea aspera is the site of origin and insertion of many muscles. Also the linea aspera has lateral and medial limbs. That is all about the femur. Okay, let's go to talk about the bones in the leg region. As we mentioned previously, the leg region is extended from the knee joint to the ankle joint. Knee joint here and the ankle joint here. In the leg region, we have two bones. This one, which locate medially, and it's a weight-bearing bone. This is the tibia. Located medially, and small bone located laterally, and it is a not weight-bearing bone called fibula. So in the leg, we have the tibia and the fibula. Also, the tibia has a proximal part, shaft, and distal part. In the proximal part, in the tibia, in this region, this is called the tibial condyle. This is tibial condyle. This is a lateral, located laterally, and this is a medial tibial condyle. This area in the tibia is called tibial plateau. Tibial plateau. Here, in the middle aspect of the superior aspect of the tibia, we have intercondylar eminence, medial and lateral. The tibia also here we have very important projection which called the tibial tuberosity. The tibial tuberosity, the site of insertion of patellar ligaments or patellar tendon. The tibial tuberosity. Here in this area we have tubercle called Gerge tubercle, the site of insertion of iliotibial tract. And in this area, the proximal and also superior aspect of the tibia, we have the site of insertion for three muscles. This area we call it the biscerineus, the site of attachment of three muscles, sartorius, gracilis, and semipindonosus. This is the shaft of the tibia. This is the medial part or medial porter, or this is a shin. This is the anterior medial surface. This is the anterior porter. This is the medial porter near the interosseous porter. The tibia and fibula are connected together by interosseous membrane, also by joint proximally. It's called proximal or superior tibiofibular joints, and distally by distal or inferior tibiofibular joint. Regarding the fibula also has proximal part, shaft, and distal part. In the proximal part we have the apex, we have the head and neck of the fibula. The neck of the fibula has a strong relationship with the common peroneal nerve, which went around the neck of the fibula. In case of fracture or compression in this area, this nerve will be injured and result in foot drop. Distally, in the fibula, we have this wire projection of the fibula is called the lateral malleolus, and in the tibia, this is called the medial malleolus. This is called the medial malleolus, and this is called the lateral malleolus. This is the posterior surface of the tibia and posterior surface of the fibula. Let's talk about the bones of the foot. The bone of the foot can be divided into the tarsal bones, metatarsal, and phalanges. In the tarsal bone, we have the bone which articulate with the tibia and fibula. It's called the talus. This is the talus. And here we have this is a large tarsal bone which called the calcaneus. This is the calcaneus. This is the talus. Anteriorly with the talus, we have this bone which located medially. This is a navicular. Also, we have three cuneiforms: medial, intermediate, and lateral cuneiform. And laterally, we have this tarsal bone. It's called the cuboid. Again, we have the talus articulated with the tibia and fibula to form the ankle joint. Calcaneus, which articulate with the talus to form subtalar joint. Navicular, cuboid, and three cuneiform. This is the first metatarsal, this is the second, this is the third, this is the fourth, this is the fifth metatarsal. Those are the metatarsal bone. The metatarsal bone have base, shaft, neck, and head. Those are the phalanges, proximal and distal. In the other digits, we have proximal, middle, and distal phalanges. Again, this is the talus, this is the calcaneus, this is the navicular, the medial, intermediate, and lateral cuneiform, this is the cuboid, this is the first, second, third, fourth, and fifth metatarsal. Those are the phalanges. In the big toe, here we have which called the sesamoid bone. This is the sesamoid bone or flexor hallucis brevis muscle. This is the sesamoid bone. Let's go to talk about the joints of the lower limb. First, we will start by the hip joint. In every joint, we will talk about the bony articulation, the ligaments of the joints, the capsule, and the movement that occur in this joint and the type of the joint. Regarding the hip joint, is the articulation between the hip of the femur is the acetabulum. The type of this joint is multi-axial, synovial, ball and socket joint. Regarding the ligaments, there are many ligaments in the hip joint. For example, this one from the ilium to the femur is called the iliofemoral ligaments. The iliofemoral ligaments is located anteriorly. Its shape is Y shape, inverted Y shape. This is the strongest ligament in the body. This is the strongest ligament in the body, is the iliofemoral ligaments. Also, we have ligaments from the pubic to the femur. It's called pubic-femoral ligaments, and posteriorly we have the ligament from the ischial spine to the femur. It's called ischiofemoral ligament, and the ischiofemoral ligament is the weakest one of these three ligaments. Again, this is the iliofemoral, this is the pubic-femoral, and this is the ischiofemoral ligaments. The hip joint has a capsule attached proximally to the superior border of the acetabulum and attached distally till the intertrochanteric line anteriorly and above the intertrochanteric crest posteriorly. As we mentioned, the type of this joint is ball and socket joint, synovial multi-axial joint. The movement that occurs in this joint is flexion and extension, abduction, internal rotation and external rotations. There are many muscles that act to flex this joint. For example, psoas major and iliacus by iliopsoas muscles. Also, there are many abductors act in this joint, like adductor longus, adductor magnus, and other abductor muscles. Regarding the abductors, mainly by gluteus medius and minimus. Regarding the extensor of the hip joint by hamstring muscles, which located posteriorly in the thigh. Regarding the blood supply of the hip joint, pipe branches from anterior, medial, and posterior circumflex femoral artery, also by trochanteric anastomosis and crochet anastomosis. Regarding the innervation of the hip joint by Hilton law, the Hilton law says that any muscles act on these joints, the nerve of these muscles innervate also this joint. So this is the hip bone. Clinically, there are many problems that may occur in this joint. For example, hip dislocations. It could be anterior or posterior. The commonest type is the posterior hip dislocation. Posterior hip dislocation. Knee joint is the complex and the largest joint in the body. The knee joint is actually the three joints. They are articulation between the medial condyle of the femur and the medial condyle of the tibia. This is the first articulation. Also between the lateral condyle of the femur and the lateral condyle of the tibia. This is the second articulation. Also the articulation between the patella and the femur is called patellofemoral joint. The type of this joint is modified hip joint. It allows flexion and extension and rolling and sliding movement. There are many ligaments located in the knee joint. For example, this is the patellar ligaments. This is one of the extra articular ligaments called the fibular collateral ligaments or lateral collateral ligaments. This is located medially is the tibial collateral ligaments or medial collateral ligaments. Inside the joint intra-articularly we have posterior cruciate ligaments and anterior cruciate ligaments. Also there are other ligaments like popliteal ligaments and arcuate ligaments. Also we have very important structure which is located inside the articular surface of the knee joints, which are the medial lateral meniscus and the lateral meniscus. The functions of the medial and lateral meniscus are to absorb the shocks, act as the cushions, also to deepen the joint. Regarding the muscles that act in this joint, for example, the main extensor of the knee joint is the quadriceps femoris muscles. The quadriceps muscles, the muscles that cause flexion of the knee joint are the hamstring muscles and other muscles. Regarding the blood supply of the knee joint, mainly by genicular anastomosis. Regarding the innervation by Hilton law, by nerves that supply the quadriceps muscles, hamstring muscles, and other muscles act in this joint. This ankle joint, first the articulation. The ankle joint is formed by articulation between tibia, fibula, and talus joint, also called talocronar joint. The ankle joint is hip synovial joint, which allow true movement, dorsiflexion and plantar flexion. The ankle joint has many ligaments, lateral ligaments and medial ligaments, which called the deltoid ligaments. The muscles that act in the ankle joints are the anterior compartment of the leg and posterior compartment of the leg. The anterior compartment of the neck, for example, like tibialis anterior, produce dorsiflexion of the ankle, and the posterior compartment of the leg, like gastrocnemius and soleus, produce plantar flexion of the ankle joint. Okay, let's go to talk about the thigh regions. As we mentioned previously, the thigh region is extended from the hip joint superiorly and to the knee joint inferiorly. And as we mentioned, the bones are located in the thigh is the femur bone, the longest, heaviest, and the strongest bone in the body. The thigh is divided by muscular compartment and the deep fascia into three compartments. Here we have the anterior compartment, and here we have the medial or abductor compartment, and posteriorly we have the posterior compartment of the thigh. So we have anterior, medial or abductor, posterior compartment of the thigh. The muscles of the anterior compartment, this is one of the muscles located in the anterior compartment. This is the sartorius muscle. The sartorius, one of the longest muscle in the body. It originates from the anterior superior iliac spine in the hip bone and inserted in the superior medial aspect of the tibia, in the pes inserenius with the other two muscles, gracilis and semitendinosus. The action of the sartorius muscle is to flex the hip joint and to flex the knee joint. It can flex two joints because it crosses two joints. This is the sartorius muscles. Also, the other name of this muscle is the talar muscle. This is called the talar muscle. Regarding the other muscles of the anterior compartment, we have the quadriceps muscles. This is the quadriceps muscles. This is the first part of the quadriceps, which is called the rectus femoris. This is the rectus femoris. Rectus femoris has two heads superiorly and one attachment distally. This is the rectus femoris, also called the kicking muscle. This is the rectus femoris. Proximally, which originates from the anterior inferior iliac spine and from the superior part of the acetabula. Here we have the vastus medialis, and here we have the vastus lateralis, and here we have the vastus intermedius. Vastus lateralis, vastus intermedius, rectus femoris, and the vastus medialis. Those four muscles are quadriceps muscles. Inserted in the quadriceps tendon, inserted in the patellar tendon, inserted in the tibial tuberosity. The rectus femoris, lateralis, intermedius, medialis, sartorius, all the muscles of the anterior compartment of the thigh are innervated by femoral nerve. The main action of the quadriceps muscles is to extend the knee joint, the main extensor or primary extensor of the knee joint. Regarding the abductor or medial compartments, all muscles of the abductor compartments are innervated by obturator nerve. This one, which is located medially, is the gracilis muscle. This is the gracilis muscle. As this one is called the adductor longus. This is the adductor longus, and this large muscle is the adductor magnus. And here we have small muscles which called the abductor brevis. So we have abductor longus, gracilis, abductor magnus, and brevis. The brevis, in the brevis we can find anterior to this muscle the anterior division of the obturator nerve, and posterior to the abductor brevis we can find the posterior division of the obturator nerve. The abductor magnus is a very large muscles inserted distally in the abductor tubercle. In the distal part we have which called the adductor hiatus. Adductor hiatus is the distal part of the subsartorial or canal of Hunter. Again, this is abductor longus, this is a gracilis muscle, this is the abductor magnus, and here we have the abductor brevis. Superiorly, we will find the pectineus muscle, the pectineus muscle. This is the femoral triangle with a triangular depression located in the superior anterior aspect of the thigh. The boundaries of the femoral triangle are the sartorius muscle, the medial border of the sartorius, also the medial border of the adductor longus, and superiorly we have the inguinal ligaments. Superiorly we have the inguinal ligaments, laterally medial border of the sartorius, medially the medial border of the abductor longus. What are the contents of the femoral triangle? The contents from medial to lateral. First, this is the femoral vein. After the femoral vein, femoral artery. After the femoral artery is the femoral nerve. This is the femoral vein which is located medially, femoral artery, and the femoral nerve. Medial to the femoral vein we can find the femoral canal and we can find the lymph nodes. Again, this is a triangle, femoral triangle. This is the boundaries, sartorius, longus, and ligaments, and the contents are vein, artery, and femoral nerve. Also, we have very important canal located in the middle third of the thigh, which called the abductor canal. The abductor canal begins at the apex of the femoral triangle. Here we will find the abductor canal. Also it's located below to the sartorius. Its other name is called subsartorial canal, also called the canal of Hunter. It started at the apex of the femoral triangle and ended in the adductor hiatus. What are the contents of the subsartorial canal? What are the contents? Saphenous vein, femoral artery, yes. Nerve to the vastus medialis, femoral vein, artery or saphenous, and nerve to the vastus medialis. The length of this canal is approximately about 15 centimeters. So it is very long canal called subsartorial canal or canal of Hunter. Here we will find this vein which is located superficially. This is a great saphenous vein. The great saphenous vein unite with the femoral vein in the superior or superior anterior aspect of the side. This is the great saphenous vein. This is a great saphenous vein with it's surrounded by a lot of fats. This is great saphenous vein. This is a deep fascia. This is a deep fascia or fascia lata of the thigh. This is a deep fascia or fascia lata of the thigh. This fascia laterally will become very thick to form which called the iliotibial tract. This is iliotibial tract is a thickening of the deep fascia in the lateral aspect of the thigh. The iliotibial tract is inserted in the superior lateral aspect of the tibia or in the Gerbi tubercle. The iliotibial tract receives two muscles proximally. One of them is called tensor fascia lata. This muscles is called tensor fascia lata. Other muscles is located posteriorly, which is gluteus maximus. Let's go to talk about the muscles of the leg. The leg is the region that extended from the knee joint proximally to the ankle joint distally. It contains 2 bones, the tibia medially and fibula laterally or posterior laterally. The leg is subdivided by interosseous membrane, intermuscular septum into 3 compartments. This is the anterior compartment, and this is the lateral compartment, and here we will find the posterior compartment. The posterior compartment also subdivided into superficial part and the deep part. Let's talk about the muscles of the anterior compartment. This is the tibia, this is the periosteum of the tibia. This is the first muscles which are located lateral to the tibia, not medial. The medial muscles are muscles of the posterior compartment which are located lateral. This is tibialis anterior. And this is the tendon of the tibialis anterior. The tibialis anterior originates from the tibia interosseous membrane and adjacent structures and inserted distally in the medial aspect, the medial cuneiform and the first metatarsal part. The action of these muscles is to produce dorsiflexion of the ankle, also inversion of the foot. This is the tibialis anterior. All the muscles of the anterior compartment are innervated by this nerve, which is the deep peroneal nerve. This is a deep peroneal nerve. This is the tibialis anterior. This is the extensor hallucis longus. This is the tendon of the extensor hallucis longus. This is the tendon of the extensor digitorum. Again, this is the tibialis anterior. This is extensor digitorum. And this is the tendon of the extensor hallucis longus. Between the hallucis longus and extensor digitorum, we will find the vessels and nerve, which are the anterior tibial artery and the deep peroneal nerve. Anterior tibial artery and the deep peroneal nerve. This is tibialis anterior again. This is the extensor hallucis longus, tibial artery, deep peroneal nerve, and the extensor digitorum. Here we will find the superficial peroneal nerve. In the lateral compartment, we have the two muscles, which are the superficial one is called the peroneus or fibularis longus. This is peroneus or fibularis longus. The deepest one is called the fibularis brevis or peroneal brevis. The fibularis longus is originates from the head of the fibula and the proximal part. The fibularis brevis is originates from the medial side of the fibula. Both muscles are innervated by superficial peroneal nerve, and the both muscles act to evert the foot. This is the dorsal venous arch, the dorsum of the foot. This is the great saphenous vein, which is located anterior to the medial malleolus. This is the great saphenous vein. This is the great saphenous vein. This is the great saphenous vein. The great saphenous vein, as we mentioned, will join the femoral vein in the superior aspect of the side. Usually, the great saphenous vein is accompanied by the saphenous nerve. This is the deep fascia of the side, also called the fascia lata. This is the deep fascia of the leg. This is the deep fascia of the side. This is the deep fascia or fascia lata of the side. Regarding the muscles of the posterior compartment of the side, are three muscles. This one is the biceps femoris. This muscle is the semitendinosus muscle. This muscle is semimembranous muscles. These three muscles are called the hamstring muscles. All of them are originated from this area, which is the ischial tuberosity. This is the biceps femoris. The biceps femoris is inserted distally in the head of the fibula. The action of this muscle is to flex the knee joint. Also, it assists in flexion of the hip joint. This one is called semitendinosus, which is located medially. The semitendinosus is inserted with gracilis and sartorius in the superior medial aspect of the tibia, in the bis miscellaneous, and this is the semimembranosus muscles. Again, this is the biceps, this is the semitendinosus, this is the semimembranous muscles. All these muscles are innervated by this nerve, which is the sciatic nerve. This is the sciatic nerve. The sciatic nerve has two portions, tibial portion and common peroneal portion. The sciatic nerve, roots of this nerve forms the L4, L5, S1, S2, and S3. Innervate all the muscles of the posterior compartment. Also innervate all the muscles in the posterior compartment of the leg. Also, the tibial nerve gives innervation to the hamstring part of the adductor magnus. Also give punch to the adductor magnus. Posterior to the knee, we have the depression called the popliteal fossa. Popliteal fossa is a diamond-shaped depression located posterior to the knee joint, usually prominent when the knee is flexed, means the knee is flexed. The boundaries of the popliteal fossa: superior medial, superior lateral, inferior medial, and inferior lateral. Superior medial, we have the semitendinosus and semimembranosus muscles. Superior laterally, we have the biceps femoris. Inferior medially, we have the medial head of the gastrocnemius, and inferior laterally, we have the lateral head of the gastrocnemius. What are the contents of the popliteal fossa? Tibial nerve, common peroneal nerve. This is the tibial nerve, and this is the common peroneal nerve. Also, popliteal vein, and deeply we will find the popliteal artery. Also, there are lymph nodes and fats. Structures that located superficially in the popliteal fossa. This vein is the short saphenous or small saphenous vein. It's usually associated by sural nerve. Sural nerve. This is the popliteal fossa in the posterior aspect of the knee. Regarding the muscles of the posterior compartment of the leg, as we mentioned previously, the posterior compartment is subdivided into superficial part and the deep part. The superficial part contains the gastrocnemius muscles. This is the gastrocnemius. This is the medial head. It has two heads. This is the lateral head, and this is the medial head. The gastrocnemius are originated from the femur. So it crosses the knee joint and it acts in the knee joint. The gastrocnemius with soleus muscles, these muscles below the gastrocnemius are inserted by this tendon, which is calcaneal tendon or Achilles tendon in the calcaneal tuberosity. This is the longest and the strongest tendon in the body. This is Achilles tendon or calcaneus tendon. Sometimes we can find the muscle between the gastrocnemius and the soleus, which is the plantaris. Plantaris, one of the 5 muscles that may be absent from the body. The plantaris also act as proprioception. It contains the muscle spindles and Golgi tendon. The innervation of the gastrocnemius and soleus by the tibial nerve. By this one. This nerve is the tibial nerve. The action of the gastrocnemius and soleus muscles is to produce the plantar flexion in the ankle joint. Beneath the soleus, we will find the deep muscles of the leg. For example, flexor hallucis longus and flexor digitorum, and other muscles that located deeply in the posterior compartment of the leg. Posterior means the leg, and the posterior compartment. Here we will find the tibial nerve, which is located deeply and associated with posterior tibial vessels. This is the tibial nerve, and this is the posterior tibial artery. Here, this is the short saphenous or small saphenous vein, which pass posteriorly to the lateral malleus. This is a short saphenous vein which ended into the popliteal vein in the popliteal fossa. This is the Achilles tendon. Again, this is a tibial nerve and associated with posterior tibial artery. This is the gluteal region. The gluteal region is extended superiorly from the iliac crest inferiorly to the gluteal fold. Between the right and left gluteal regions there is natal cleft. The outer surface of the gluteal region started by skin, then superficial fascia and fat, then the fascia, deep fascia, and then the muscles. The contents of the gluteal region are muscles, which is subdivided into superficial group by this muscle, gluteus maximus, by abductor, gluteus medius, and minimus and tensor fascia lata. Also we have deep muscles is the gluteal region, which are the short rotators of the hip. Again, this is the iliac bone and this is the sacrum. This is the phalanx muscles, is the ulceus muscles, and the largest muscles in the gluteal region, which is the gluteal maximus. The gluteus maximus is one of the muscles that extend the hip joint. Extends the hip joint. It has two insertion sites. One 3/4 of the or the superficial 3/4 of the gluteus maximus inserted in the iliotibial tract, the deepest fibers, and the deep quarter inserted in the gluteal tuberosity in the female. This is the gluteus maximus, is the largest muscle in the gluteal region as the bulkiest muscle in the body. It's innervated by inferior gluteal nerve. When we remove the gluteal maximus, we will find the gluteus medius or hip abductors. This is the gluteus medius and gluteus minimus. Gluteus medius and gluteus minimus are innervated by the superior gluteal vessels. Superior gluteal vessels. These two muscles are abduct the hip joint, also stabilize the pelvis during standing and walking. Most of them are innervated by superior gluteal nerve. This is superior gluteal nerve and this is the superior gluteal vessels. This muscle is the gluteal region, one of the muscles of the deep compartment or deep layers of the gluteal region. This is the piriformis. Piriformis is a landmark that originated from the sacral vertebra and inserted in the greater trochanter. Piriformis is a landmark. There are a lot of structure originate or pass superior to the piriformis, and they are structure passed through inferior to the piriformis. Structures that pass superior to the piriformis are superior gluteal nerve and vessels. Structure passed inferior to gluteal to piriformis are sciatic nerve, inferior gluteal nerve vessels, and posterior nerve to the side. Those are the short rotator. This is superior gemellus. This is obturator internus. This is inferior gemellus, and this is quadratus femoris. This is quadratus femoris. Those are short rotator or muscles of the deep gluteal compartment. This is the posterior compartment of the side. This is the muscle of the posterior compartment of the side. This is the medial aspect, and this is the lateral aspect. The lateral aspect in the model, this is the biceps femoris. This is the biceps femoris, one of the hamstring muscles originated from the gluteal ischial tuberosity. This muscle is semitendinosus and semimembranosus. Semitendinosus with this muscle gracilis and this muscle sartorius, all of them are inserted in the insulaneus, in the superior medial aspect of the tibia. When we remove the biceps and when we remove the semi-muscles, we will find the sciatic nerve. This is sciatic nerve. The sciatic nerve, as we mentioned previously, so originate from L4, L5 plus 1 is 2, S3, and it has two portions, common peroneal and tibial portion. Common peroneal and tibial portion. This muscle is the hamstring part of the adductor longus. This is the hamstring part of the adductor longus, and this is the vessels in the popliteal fossa, vein, and popliteal artery. This is the leg region, and this is the posterior compartment of the leg. The posterior compartment is subdivided into superficial and deep compartment. This is the lateral head of the gastrocnemius. This is the medial head of the gastrocnemius. This is the calcaneal tendon or Achilles tendon inserted in the calcaneal tuberosity. When we remove the gastrocnemius, we will find the soleus muscle. This is the soleus muscle, one of the anti-gravity muscles. This is originated from the soleal line posteriorly in the tibia and associated interosseous membrane and inserted with gastrocnemius by calcaneal tendon or Achilles tendon in the calcaneus. Soleus muscle, gastrocnemius are muscles for plantar flexion. When we remove the soleus muscle, we will find the deep compartment, the deep muscles of the posterior compartment of the leg. Here we will find the tibial nerve associated with posterior tibial artery. This is a tibial nerve and this is a posterior tibial artery. This is the five regions. This is the anterior compartment or some muscles of the anterior compartment. This is the medial compartment or abductor compartment. This is a sartorius muscle. popliteal muscle. This is the rectus femoris muscles. This is the vastus medialis. This is the vastus lateralis, and beneath the rectus femoris we will find the vastus intermedius. Here we will find the femoral triangle. Femoral triangle. This is the pectineus muscle. This is the adductor longus muscle. This is a femoral vein. This is a femoral artery. This is a femoral nerve. This is the gracilis muscles, which one of the muscles of the adductor or medial compartment. It's innervated by obturator nerve, adductor longus by obturator nerve, as this one is the adductor magnus. Here we will find the subsartorial or canal of Hunter.